Thank you very much, Mr. Jolly. I thank, Madam Speaker, I thank my Republican colleagues for joining here. Vitally important issue. And I rise today to call for a vote on a Zika funding bill that's free of partisan hot-button issues and free of political gamesmanship. And I'm proud to join in this call for action with my Florida colleagues, Democrats and Republicans alike. We've come together above partisan divisions to support the administration's request for emergency Zika funding. And our ability to come together and the refusal of the rest of this Congress to do the same is telling. South Florida is actively fighting outbreaks in South Beach and Wynwood. There are cases in Broward County. There are cases in Palm Beach County. We've seen locally acquired cases in my home district. And my constituents, the constituents of my colleagues as well from throughout Florida, are feeling the anxiety and the fear that comes when there is so much out of their control. It's time for Congress to do all that we can to help stop the spread of this virus. This Congress's inaction is hurting Florida's families. As Representative Corbella points out, it's hurting our economy. And I have 3 children. My twin daughters are just settling back in to start a new year of college. And today, by the way, I share with my Florida colleagues, they're celebrating their 21st birthday. My son is finishing up high school. But it feels like just yesterday when my wife and I were anxiously expecting each of their arrivals into our lives. And like most Americans who are starting a family or growing a family, we experienced the full range of complex emotions as we waited for their births. The sense of not knowing what's going to come, the excitement, the anxiety, anticipation, the joy. Unfortunately, the Zika virus is threatening the joy of growing a family for thousands of Floridians. And we're just not doing all that we can to stop it. In December last year, after outbreaks in Brazil were connected to devastating birth defects, the New York Times reported a warning from the United States Centers for Disease Control and Prevention. CDC warned at the time that imported cases, and I quote, will likely increase and may result in the local spread of the virus in some areas of the United States. Now, at that time, 2,700, in December, 2,700 babies have been born with microcephaly in Brazil, an increase from 150 the year before. These babies were born with abnormally small heads. And now we know from subsequent research that Zika virus attacks growing cells that cause incomplete brain development and smaller heads in these children. These birth defects are devastating. They're also incurable. And these children will have lifelong problems with their vision, their cognitive ability, and other complications as well. Now we know that the CDC's warning in December has become a reality in Puerto Rico and in South Florida. Verified cases have exploded in Puerto Rico. In the span of only a few weeks, from the end of July until today, total cases of Zika on the island have jumped from 5,500 and 672 in pregnant women to nearly 14,000 total and 1,000 cases in pregnant women. If these trends continue, experts expect that a quarter of the population of Puerto Rico will be infected, or 887,000 infections. That unfortunately would represent tens of thousands of babies born with microcephaly. And the cost of care and the toll on families are staggering. This is an issue that affects families. It's also an issue that winds up affecting their communities. The lifetime cost of medical care for each of these children will be in the millions of dollars. And while the virus is spreading rapidly in Puerto Rico, experts like virologist Tim Tellingheisen of Scripps Research Institute said that the situation in Puerto Rico could very much happen in Florida. Now, over the past 7 weeks, as Congress was in recess, Florida cases went from 311 with no local infections to over 600 cases, including 56 local infections. The number of cases in pregnant women has doubled. Our constituents are at risk. And for us, this is not a political fight. And honestly, in my heart, I don't understand how this has become a political fight for those leaders who have blocked the Zika funding in a clean bill. I understand, my colleagues here understand, that we serve in the most polarized Congress in history. And there are all kinds of issues that we could debate, ways that we might get at that, and ways that we could change it as we need to. We've seen the divide over and over again between Republicans in Congress and President Obama. But the funds requested in this Zika battle, the funds requested to fight Zika, are not grounded in ideology. The president didn't wake up one day and say, I think we should have a $1.9 billion to fund Zika. After the warnings following the outbreaks in Brazil, President Obama went to the scientists and the experts at NIH and CDC and other agencies and asked, what will it take to respond? His request to this Congress represents their answer. And as we heard last week, the funding situation is now dire. Dr. Tom Frieden, the director of the CDC, said, basically, we're out of money. So I join my colleagues here because it's past time to act. We have to put these political battles behind us. We have to do, and we have the opportunity to do here, something that I think is not only the right thing for us and for, more importantly, for our constituents, for the American people, but we could do something that would actually perhaps set an example. We should elevate the common good. We have to protect American families, and we have to pass a clean funding bill to stop the spread of Zika. And I would just relay one conversation I had on my way out of the office, my friend, Mr. Jolly. I was talking to a staffer of mine about the coming months, and the conversation turned to November, when there's an election. And sometimes people from D.C. like to volunteer on campaigns the weekend before the election. A woman in my office who said she just doesn't think that she's going to be willing to come down this year out of fear of Zika. How do we not show that we can act in a way that responds to a public health emergency, and only to that public health emergency, without bringing in all of these other issues? We've got to do this. I'm really grateful to be here on the House floor, and I'm really thrilled to be here with my Republican colleagues who are as committed to doing this as I am, and I'm so grateful for the opportunity to share this time with you. Thank you very much.